Cancer survivors who are active live better and longer than cancer survivors that aren't active. Cancer survivors who are active and also exercise live better and longer than cancer survivors who are active but don't exercise. Well, that's great news. So let's get moving. Easier said than done. Because it's hard when you've had your body, brain, and confidence crushed by either cancer and/or cancer treatment. This is why cancer survivors often report pain, weakness, exhaustion, and fatigue for months and sometimes even years after treatment. So, what is activity? And what is exercise? And why does the research say they are so important in the quality of your life, the length of your life, and even your overall survival? So let's back up a bit. Would you believe that pushing a lawnmower around your yard for an hour and a half may not actually count as exercise? Yet standing at your kitchen counter and slowly rising up and down on your toes 5 times does. Well, that sounds ridiculous at first, doesn't it? So what gives? People often think movement is movement. As a matter of fact, the average person on the street, and probably many healthcare professionals, cannot always clearly define the difference between activity, exercise, and rehabilitation for that matter. Yet activity, exercise, and rehab are 3 distinctly different things. And understanding the difference and why each of them is crucially important could completely change how you age, how you function, and how you recover and build your body after illness, injury, or with or beyond cancer. So let's talk about it. This is the After Cancer Podcast. I'm your host, oncology physical therapist, Dr. Leslie Waltke. For more than 3 decades, I've walked alongside people living with and beyond cancer. Whether you are a survivor, a caregiver, or part of a clinical team who cares for them, I'm glad you're here. Because life after a cancer diagnosis can feel uncharted and confusing, even when you have a great medical team. In this podcast, evidence, empathy, and the real human experience come together to help you navigate the physical, emotional, and practical realities of cancer and the life that comes after. This is the After Cancer Podcast, rooted in medicine, spoken in human. Hello, After Cancer community. This podcast is brought to you in partnership with Cure. Welcome back and welcome to episode 13, Why Cancer Survivors May Stay Exhausted Even When They're Active. Before we jump in, if you are finding value in these conversations, in these podcasts, please take a moment to subscribe, share the episode, or leave a review. It really does help this podcast reach more people navigating cancer, survivorship, and recovery. Thank you. So yes, the research is clear. Your quality of life, your lifespan, and most importantly, your health span depend on activity, exercise, and rehabilitation. Let's pause here real quick to point out a very important distinction and a few definitions. What do we mean by lifespan and health span? In medicine, we spend a lot of time talking about lifespan. Your lifespan is simply the number of years you are alive before you die. But we do not spend nearly enough time talking about our health span. Our health span is the quality, health, and function of the years that we are alive, especially those last ones. For example, someone can live to 90 years old, which is a great lifespan, but spend the last 20 years unable to walk long distances, unable to get up off the floor, struggling to climb stairs, exhausted by basic daily tasks, socially isolated, physically dependent on others, and no longer able to do the things that once brought them joy. That is a long lifespan, but not a good health span. On the other hand, someone else may be traveling still at 80 years old, gardening, playing with their grandchildren, volunteering, walking independently, getting up and down from the floor, carrying groceries, exercising, still fully in control of what they do and fully participating in life. That is a good health span. Or think about 2 people after cancer treatment. One survives cancer but spends the years after severely deconditioned, fearful of movement, chronically fatigued, losing strength, balance, and independence. while another survivor slowly rebuilds strength, endurance, confidence, and function, and returns to meaningful activities, relationships, hobbies, travel, work, and life. Both may have survived cancer, but their health spans look very different. So, back to activity, exercise, and rehab. Yes, they are each different things, and each is necessary and incredibly important. Because often what the body actually needs is not just more random movement. Sometimes it needs specific movement, targeted movement, intentional movement, movement prescribed for a reason. Remember, this is your lifespan and health span we're talking about, so this is a big deal. One of the biggest misunderstandings I see in healthcare is that people assume being tired after doing something automatically means you've exercised. I was on my feet all day. I cleaned the house for 3 hours. I walked around Costco. I did yard work all weekend. And listen, those things can be and are often exhausting, and those things absolutely count as physical activity. And physical activity, as we will learn, matters tremendously. But still, activity and exercise are not automatically the same thing. And this distinction becomes incredibly important during and after cancer treatment, because many survivors are dealing with muscle loss, fatigue, deconditioning, balance changes, neuropathy, pain, stiffness, fear, weakness, cardiovascular decline, cognitive impairments, and loss of endurance. And simply being busy all day does not necessarily rebuild those systems. Many people say movement is medicine. But if that's the case, like medicine, type and dosage matter. So in activity and exercise, dose typically means intensity. And here is something important to understand. Activity can be light, moderate, or vigorous. Exercise, too, can be light, moderate, or vigorous. So how hard you are working to do something does not determine if the thing you are doing is exercise. Going back to our opening example, busting your butt to mow the lawn with a push mower is likely exhausting, but it is classified as activity. While going up and down on your toes to strengthen your ankles may not increase your heart rate significantly, yet it qualifies as exercise. So let's talk about activity and exercise, their definitions, and also why they are both so important. Let's start with activity. Physical activity is any movement that requires energy that happens throughout daily life. So things like walking through the grocery store, taking the stairs, doing laundry, vacuuming, gardening, cooking dinner, walking the dog, cleaning the garage, making a meal, or simply just standing instead of sitting. Exercise, on the other hand, is planned, structured, intentional movement designed to improve something specific within the body. So when you raise up and down on your toes to strengthen your calves to help improve your ankle strength, it's exercise. Now let's talk about the importance of each because they both really matter a lot. Let's start with activity. Reducing sedentary behavior with activity is one of the most important things we can do for our long-term health. Prolonged inactivity affects blood sugar regulation, cardiovascular health, lung health, strength, mobility, bone health, circulation, and even brain function. And yes, I know, for some cancer survivors, simply increasing daily activity again after treatment is a major and meaningful milestone. I have worked with patients who were so exhausted during chemotherapy that showering felt like climbing a mountain. Walking to the mailbox was difficult. Standing long enough to cook a meal felt overwhelming. So when those individuals slowly begin moving again, that matters deeply. But activity alone does not always restore lost capacity. So that brings us to exercise. So what is exercise? Well, again, it's intentional. It's done to improve something specific within the body, whether it's strength, endurance, balance, mobility, flexibility, cardiovascular fitness, bone density, or even cognitive health. The intentional movement of exercise creates adaptation. The body adapts to the demands placed upon it with getting stronger or more capable. That is why mowing the yard may not significantly strengthen your calf muscles, But repeatedly rising onto your toes in a controlled way absolutely might. One is general activity, the other specifically loads and challenges a muscle group with intention. This is also why carrying groceries is not necessarily the same as progressive resistive exercise. One may maintain a certain level of function, the other intentionally builds strength. And this matters because many people think they are exercising when they are just really surviving busy days. One of my patients once told me, "I don't understand why I'm still so weak. I'm exhausted every night." But when we looked at her day, she was spending enormous energy simply compensating for dysfunction. She was moving inefficiently. Everything took more effort because her body had become so deconditioned after treatment. She was tired, but not physically conditioned. Those are not the same thing. Now let's talk about why exercise matters so much during and after treatment. Cancer treatment affects nearly every system in the body. Chemotherapy can contribute to muscle loss, cardiovascular decline, neuropathy, and fatigue. Radiation can contribute to stiffness, fibrosis, pain, and loss of mobility. Hormonal therapies in both men and women can affect joint pain, bone density, and muscle mass. Surgeries can alter posture, strength, flexibility, breathing mechanics, and movement patterns. And prolonged inactivity during treatment can create rapid deconditioning. The body loses fitness much, much faster than most people realize. Research consistently shows that appropriately prescribed exercise during and after cancer treatment can improve fatigue, endurance, strength, mood, sleep, quality of life, physical function, and even treatment tolerance, treatment effectiveness, and can even affect recurrence risk and overall survival. That's powerful. Still, studies also show that most cancer survivors still are not exercising enough. And some of that is just due to altered understanding. So please know, exercise is not about becoming a fitness influencer. It's not about having six-pack abs. It's not about punishment. It's about helping the body function better. It is about preserving independence, reducing suffering, improving confidence, maintaining participation in life. It's about you. And importantly, exercise doesn't have to involve going to a club, buying special clothes, or working yourself until you're sore. Exercise does not have to begin at an advanced level. Sometimes exercise begins with standing up from a chair 5 times, walking for 2 minutes in a pair of blue jeans, practicing balance while holding onto a counter, learning how to breathe again deeply after surgery, stretching tight tissue after radiation. Small does not mean meaningless. If you are pretty limited in what you can do physically, start low, progress slow. Slow is better than no, and something is always better than nothing. Small movements can and do create enormous life impact. So now let's throw in talking about rehabilitation, because this is where things become even more important. Cancer survivors, have you ever noticed that if someone has a knee surgery, is in a car accident, has a stroke, or is diagnosed with a neurological disorder, they immediately get sent to physical therapy? And they are sent to PT because they are experiencing pain, limited mobility, weakness, loss of function, and may need help from others to get through the day. Do those symptoms sound familiar? Well, of course they do. Yet PT is not automatic in many cancer centers yet, though it should be. And this is why so many survivors still live with unnecessary loss and suffering during treatment and in survivorship. So please listen. If you are still tired, still stiff, still hurting, still leaking, still not strong, still struggling with balance, daily tasks, or poor energy, you deserve all of that restored, which means you deserve a physical therapist just like everyone else who goes through something physically traumatic. So here I want to point out a difference between exercise and rehab. When patients and survivors do complain of these symptoms, friends, family, and well-meaning clinicians may just say, well, go exercise. Yet often people do not simply just need exercise. There are many symptoms, impairments, and disorders that can't be exercised away. For example, if someone has a stroke, they don't just get sent to an exercise class. They need assessment, problem solving, guidance, treatment, adaptation, progression. A person recovering from breast cancer surgery may need help restoring shoulder mobility so they can reach overhead again. Someone with severe neuropathy may need balance training to restore and reduce fall risk. Someone with severe neuropathy may need balance training to reduce fall risk. Someone with radiation fibrosis may need mobility work, stretching, and manual therapy. Someone with bone metastasis may need highly modified rehab prescription for safety. Someone with vertigo or pelvic pain after treatment may need specialized rehab also. Here's something else really important that I see way too often. Sometimes survivors quietly normalize dysfunction because they assume suffering afterward is simply expected. I hear this all the time. Well, I guess I just thought this was my new normal. And that is very damaging because oftentimes it's not normal and can be improved. One patient I worked with had stopped going to her granddaughter's soccer games because walking from the parking lot to the field just exhausted her. Another stopped traveling because she was afraid of falling in the airport after chemotherapy-induced neuropathy. These are not simply fitness problems. They are participation in life problems. This is why rehab matters so much. So how do you know if you may need rehab? Well, the very best way is to go to a physical therapist or physiotherapist and have them fully evaluate you to check all of your symptoms and check all of your systems, and then they will let you know. But you may benefit from rehab if you are experiencing these things: difficulty climbing stairs, trouble getting off the floor, falls or near falls, persistent weakness, persistent pain or pain that limits movement, persistent fatigue, balance problems, difficulty walking, persistent stiffness, swelling or lymphedema, neuropathy, fear of movement, difficulty returning to work or hobbies, loss of endurance, difficulty carrying groceries, or completing daily tasks. This stuff is common after cancer treatment and deserves to be treated. And please hear this clearly. You do not need to wait until things become severe before seeking help. Earlier intervention is often better. At the end of the day, the goal is not perfection. The goal is not becoming the fittest person in the room. The goal is participation in your life. The goal is getting you back to the maximal health and function and vitality possible. Can you safely do the things that matter to you? Can you move through your world with confidence? Can you physically participate in your relationships, hobbies, work, travel, parenting, grandparenting, and daily life? Because surviving cancer is one thing. Living fully afterward is another. And this is where exercise, activity, and rehabilitation all intersect. Activity keeps us moving. Exercise helps us adapt and improve. Rehabilitation helps restore comfort, lost function, safety, and improve participation. All three matter immensely. One of the things that shuts down movement in cancer survivors is fear. As a cancer survivor, you know fear and its horrific presence and power. And this is one of the things that often happens after cancer treatment. So people begin to lose trust in their bodies. Sometimes that fear is obvious. A person is afraid to lift something after surgery, afraid to exercise after a diagnosis involving the bones, afraid their heart rate will go up, afraid they will become more fatigued. But sometimes the fear is much quieter. People simply stop doing things. They stop walking as far, stop taking the stairs, stop traveling, stop exercising, stop carrying things, stop getting on the floor, stop participating physically in life. And over time, the body adapts downward. Muscles weaken, endurance declines, balance worsens, confidence shrinks. I often tell patients and survivors the body is incredibly adaptable, but it does not always adapt in the direction we want. If we consistently challenge it safely and progressively, it adapts upward. If, however, we stop asking it to do things, it will adapt downward. That is not failure, that's physiology. And unfortunately, cancer treatment can create the perfect storm for deconditioning because treatment itself is exhausting. Appointments are exhausting. Fear is exhausting. Interrupted sleep is exhausting. Stress is exhausting. And unfortunately, many survivors hear these messages from well-meaning loved ones and healthcare providers that unintentionally reinforces inactivity. Things like take it easy, rest, don't overdo it. Now, to be clear, rest absolutely matters. Recovery matters. But complete inactivity is rarely the answer long term. Appropriately prescribed movement is one of the most powerful tools we have in modern cancer rehabilitation. I remember working with a gentleman after a stem cell transplant who told me he felt like he had aged 30 years in 6 months. Before cancer, he was active, independent, and physically capable. After treatment, he became short of breath just walking short distances, struggled climbing stairs, and no longer trusted his balance. What struck me most was not just the physical decline, it was the emotional impact. He said, "I don't feel like myself anymore." And honestly, I hear versions of that statement all the time in cancer rehab because movement is deeply tied to identity. Being able to walk independently, carry your child, travel, work, exercise, cook, garden, play golf, hike, clean your house, get down on the floor with grandchildren. Those things are not just physical tasks, they are pieces of life. And when people lose those abilities, it affects confidence, independence, relationships, and your emotional health. The good news is that the body can often improve far more than people realize. I have watched survivors who could barely walk around the clinic eventually return to traveling internationally. I have watched people, terrified of movement, slowly rebuild trust in their bodies. I have watched patients regain strength, endurance, and function years after treatment ended. The body remains adaptable, but it usually requires intention. Another important thing to understand is that an exercise prescription should not be one size fits all. What a healthy 30-year-old marathon runner needs is very different from what an older adult with neuropathy after chemotherapy would need. What someone recovering from a stem cell transplant needs is different from what someone recovering from breast cancer surgery needs. This is why individualized care really matters. Some people need gentle progression, some need balance training, some need strengthening, some need cardiovascular conditioning, some need mobility work, some need all of the above. And importantly, exercise does not need to look impressive to be effective. Social media, unfortunately, has convinced many people that exercise only counts if it is intense, sweaty, or dramatic. That, again, is simply not true. Sometimes the most medically important exercise is very small and very specific. Standing from a chair repeatedly may help someone maintain independence. Practicing balance may prevent a devastating fall. Walking intervals may improve endurance enough to return to work. Breathing exercises may improve rib mobility and posture after surgery. And this is exactly why understanding the difference between activity, exercise, and rehab matters so much, because not all movement serves the same purpose. And when we understand what the body specifically needs, we can begin training with intention instead of simply hoping exhaustion means progress. Here are 3 things I want you to consider as we close today. First, I want you to think and reflect honestly about a few things. Has your world gotten physically smaller since cancer? Have there been activities you quietly stopped doing? Have you mistaken exhaustion for conditioning? Are there things your body used to do that you miss? What would improving your health span allow you to do again? And ultimately, what and who are you surviving for? Again, your body is always adapting to something. The question is, are you adapting towards strength or are you adapting towards weakness? Secondly, I want you to take a nice, refreshing walk that fits you today. Whether it's 2 hours or 2 minutes, it doesn't matter. Whatever makes you feel good and helps you adapt forward. And third, seek out the rehab you deserve. Please talk with your physicians and nurses or fellow survivors to help find a good rehab therapist in your area. They can help you determine what you need, what you don't need, and help you find the best exercise plan for you in your community. I'm Dr. Leslie Waltke. As always, thank you for joining me for this episode of the After Cancer podcast. And thank you for being here today and for being a part of the After Cancer community, a group of people navigating cancer, survivorship, and life with or beyond a cancer diagnosis together. And remember, the goal is not simply surviving longer. The goal is maintaining the ability to live fully within those years. I've already said it once. I'm going to say it again. Exercise like your life depends on it, because it does. You are not alone, and you do belong here. Peace out. I look forward to seeing you again soon.